What's up, guys? Welcome to another episode of Consciously Curious, where we try to break down people that are thriving in their careers and love what they do. Today we have Shelley Kleinman, physical therapist and founder of Erasore. So, Shelley, thanks for spending the time in this lovely afternoon. I'm sure you'd and I would love to be outside at this time, but we're here to deep dive into the world of physical therapy. So let's start off with how long you've been in the game.
Well, I graduated in 1988.
Oh my!
Before you were born.
Right.
Yes. Yeah. When it was only required to have a bachelor's degree.
Okay.
Today there's a PhD program.
Oh wow.
Yes.
So how was it? A year or 2 years or?
It was 2 years for the actual program.
Yeah.
2 years of prerequisites. But as
so 4 years total,
4 years
like you said, it's a
total.
bachelor's essentially.
Correct.
Now, through your time working, have they required anything to catch you guys up to speed, or have they just accepted work-life experience?
We grandfathered in, right? But we are required to continue to educate ourselves and to be educated through continuing education courses.
Okay.
To maintain our degree, our license.
No, you're fine. So if you were to go back to 84, did you have options at that time, or were you set on physical therapy?
Well, that's a good question. That's all I ever really wanted to do.
Okay. And how did you discover it and get into it?
Right. Well, all my life I was interested in the body.
Okay.
Back then, as we had previously talked about, it was you were a doctor or a nurse. Right. So I thought, I'll be a doctor. And then I realized I don't want to work that hard. I don't want people's lives, depending on me. And also once I discovered physical therapy, and that was because my father and mother had it, and there was a career day also in high school.
Oh, okay.
And a physical therapist came, and I remember thinking, that's it. That's everything I want to do. I want to know the body, and I want to heal the body, because I've always known that I have sort of a natural...
Sure.
There's healing in my family.
Sure.
We go back. We have doctors, but we also have, really healers. Somebody... someone from Russia.
Oh, okay.
Okay. Who was considered the healer. People would go to her, and she...
Like a shaman?
Kind of.
Oh, okay.
Yeah.
Okay.
Yeah, a little mystical.
Okay.
So it's in my blood. And so I was always the one to give massages and, just... Right. Do kind of... And so once I heard about the physical therapy, I thought that's it.
Okay.
That really encompasses everything I want to do.
And back then, were you aware of options like being a massage therapist or a chiropractor, or an occupational therapist? It's like, right now, it's like people probably wrestle with these options.
Yeah, it possibly, but once it was that PT who came to career night, and that did it for me.
What a crazy age, in high school, to already be set. Those are the lucky ones.
I know. I realize that,
Those
especially
are the lucky ones.
Right. I know that's unusual, because I have 3 kids, and no one's that I want to do this. So,
Yeah.
Right, and truly, I wasn't accepted to the PT program right away. So,
And why was that?
Well, it was very competitive, and it
Right.
still is.
Sure.
I was an average student.
Hey, I'm speaking to the same
Right.
mindset.
I mean, B's, straight
Right.
B's, but I had to work for them.
Mm-hmm.
And then I really, if you think about it, my freshman year in high school, my father died, so my grades plummeted. It was, C's and D's, so
Yeah.
I was kind of working my way back up. And even in college, I'm kind of a late bloomer.
Sure.
Right. It took me a while to kind of get into the groove.
Right.
And so I started lower and then just worked my way up. So my grades weren't phenomenal.
Yeah.
And I was rejected. And I thought, but I want to be a PT. So I just continued.
What you had to do, yeah.
Right. and I got rejected a second
No
time.
way. You didn't give up after that, obviously.
No. I knew this was what I wanted to do.
So what'd you do? Did you try other programs or just like do stuff to bolster your experience or GPA a little more?
Well, I finished, right. I mean, by then I was doing really well in college, but I finished my liberal arts degree, which I'm so thankful for, because a good, well-rounded education is something that everybody could use.
It's more than the GPA. I know.
Absolutely. But then I also, I was fortunate, a friend of the family is a PT himself, and he hired me to be a PT assistant.
Okay.
Now, gone are the days where you can't do what I did, what I was allowed to do back then.
You need a certificate or something else, right?
Right. Okay. You can't lay a hand on a patient if you don't. So I was actually treating patients before I even went to school. I always say school was a formality.
Yeah.
Because I was doing it.
Right, right.
I wasn't evaluating or determining, the approach, the treatment plan, but talk about learning on the job. Plus, I was already, like I said, I was massaging people. I was working on bodies. I worked on my own body.
Right. Well,
and so
the fact that you had a passion for it, you were willing to do everything to get better and better on your own time.
Yeah. There was nothing else I wanted to do.
Right.
I really... And then I got accepted to both programs I applied to.
Wow.
So it was, it was a good feeling.
Did you never had that feeling of like, maybe this isn't for me. You just like kept going and going. Good for you.
Thank you.
Good for you.
Right. Yeah.
And nowadays, is it a requirement to be a PT assistant to get into PT school or?
No.
Oh, it's not.
Yeah.
Okay.
Yeah.
I'm sure it's like very helpful though. They don't require any patient care experience?
Well, yes, you have to volunteer.
Oh, okay.
Or observe.
Okay.
Observe. You have to put in
What if I wanted to do it and I'm a paramedic? I've had patient care experience. Is that different?
It is different.
Oh,
you have to
man.
go into, a PT setting, and I can't remember the hours. It might be 50, 100. Sorry.
Last week, to go to law school, you don't need to be a law clerk.
Ah.
That threw me off too. It's like,
did.
really? And you don't even need to know what specific kind of law you want to practice. I wish, like, I think you should have a sense of direction. Otherwise, the school is maybe just like a for-profit program, and they're not really nurturing people that know what they want to do, I guess. So it's great that physical therapy programs still look for very specific patient care experience prior to entry.
And because it's so many hours, typically they go to different types of clinics.
Yeah.
So hospital, outpatient, peds, depends.
Yeah.
The more you can see.
For someone trying to seek out volunteer opportunities, do they just walk in the door and ask, or is there a list that you can just email and phone call, or?
Yeah, you just pretty much phone call.
Really?
Yeah.
Okay.
So I've had some people come in, to my clinic and observe.
It's very very rewarding and encouraging to see experienced practitioners give back. I mean, you got to remember what it was like to be a student, right? And it's discouraging to see people neglect up and coming junior colleagues. It's sad. As an instructor, I see that from time to time when students come back and tell me that they had a poor time at their clinical experience because their preceptor rolled their eyes when they found out they had a student.
Oh, okay. Well, once you're in PT school, you also do clinicals.
Oh, okay.
So then you have that's more formal, and it is time consuming.
Yeah.
I've done that too in the past, but it is good. It's wonderful.
Walk me. I guess let's see how relevant it is today. But like, walk me through school. Like, was it hard, or did it come naturally to you because you had a passion for it?
I did have a passion.
Right.
Well, you mean the actual PT program or all the prerequisites?
No, just the bread and butter.
It was once you're in, they want you to succeed, so it's very supportive, and I loved it. Loved every minute of it.
Okay.
It wasn't hard.
It wasn't hard?
No.
Some would say even when you have a passion for it, it's going to be one of the hardest things you do, like because you naturally want to be the best at it, so you put that much more work into it. But I mean, it is what it is.
being that B student,
Right.
I was
There's something
happy
to
with that
prove,
too. Yes, but I didn't need straight A's.
Okay.
I was in the program. I had worked so hard to get into it. I had waited so long to get into it that once I was in, I was so happy to be there that.
You know, it's also really nice when you're learning to learn and not to get a letter grade. It kind of takes the edge off.
Well, absolutely. So I was accepted to both U of I and Northwestern.
Oh, okay.
Okay. So Northwestern had an accelerated program though. I think it was 18 months.
Wow.
Versus 24. And even though I was older, I had to, I had been rejected and I still felt like I didn't want to go through a fast program. I didn't want it shoved down my throat. So I knew, I guess I had that wisdom.
Yeah.
I just wanted to have not an easier time, but when you do have to push through something, it's like eating. It's really...
You want to enjoy it.
Yeah.
You want to absorb it, enjoy it. Yeah.
That's right. That's right.
Okay.
Yeah.
And maybe when did you find out? Are there different kinds of PTs? Are there niches within the world of physical therapy?
Absolutely.
I think one that comes to mind is a pelvic
floor.
Pelvic floor, right?
Very good.
That's very random. I just saw that on social media the other day.
Yeah.
But at what point did you know what kind of physical therapist you wanted to be?
Well, there are specialties. So
I guess that's
you
what
can,
I'm
yes, you can become a specialist.
Okay.
I'm still general.
Oh, okay.
I like variety. And so actually I've done work with the pelvic floor.
Okay.
My first job was at the hospital because I felt like it was general enough.
Yes. I was going to go there.
Right. So I worked at U of I Hospital. Here I went to UIC undergrad. I accepted the place at the U of I Med Center. That's what it was called then. Actually, it was called Chicago Circle Campus too.
It
by
was
the way.
Yeah, I know.
Yeah, my daughter always corrects me.
Were you able to hang out on top of the quad? Was that all connected back then?
It was all connected.
Oh.
Yeah.
Their current 10-year plan is to bring an ice rink into the quad.
Oh, wow.
Yeah.
Oh, my. Oh, yeah, it was very different. No dorms, the concrete jungle.
Yes.
Right.
Yeah.
Right.
Built for the riots, right? Like the minimal windows and very archaic architecture.
Yeah. But you know what? I still say it's a gem of an education there in the middle of the city. Yeah. So then I went to the Med Center.
Okay.
And lived in that area in Little Italy. And then I went to work at the hospital. And it was terrific because I did cardiac rehab. There's PT, you can work with cardiac patients.
Is this all in the basement of that hospital? Because that's where it is now. PTOT is down there. Okay.
Yes, frequently they're in the basement with
cool.
no windows.
No windows.
Yeah.
I'm in the OR, so no windows for me too.
Good. Yeah, right.
So before I got the teaching role, I checked fire extinguishers all over campus. So that's why I'm kind of familiar with the nooks and crannies of campus.
Exactly. And we did wound care.
Okay.
I was also involved in the Hansen's disease program.
Okay.
Do you know what Hansen's disease?
No idea.
Leprosy.
Oh, and I still have no idea. I mean, it's vague in my head.
Yeah. So that was my well-rounded and ortho. We had a lot of people who had amputations, a lot of inner city people who were diabetic. Back then, interesting, Medicare would cover and pay for an amputation.
Yeah, wow.
Instead of the shoes that would protect their feet to minimize,
Where are our priorities?
Right. So now Medicare pays for diabetic footwear to prevent these wounds from becoming gangrenous and
Oh, that's the worst.
And I know. So that gave me my well-rounded education there. And then, my specialty in a way is hands-on manual therapy. Okay. And you can become a manual therapist, but I just
you like the variety, like
I
you
do.
said. Yeah.
I do.
Same with emergency medicine. That it just keeps it fresh. You never get the same patient twice, kind of thing.
Right. I want to be able to treat the entire body, because it's all connected.
Right.
And
Now with these specialties, are there special certificates or fellowships they have to complete to maintain these specialties?
Yes, certain number of hours,
Okay, like every year or just like coming up to it?
I think leading up to it,
And then
but
that's
honestly,
it's like...
right. And then you just need to continue anyway with your continuing education courses. But once you're a specialist, you're a specialist. As long as you pay the dues.
The dues, right. It's like a firefighter or a cop that doesn't have to keep up with their body. What's up with that,
That's funny.
Okay, well, and then after the hospital, what did you do next? Where did you go after that?
Yeah. So I had my first baby.
Okay.
And then we moved, and it was just too far for me to go. Okay. So I actually did home health for a little while.
Like outcalls?
Going to people's homes.
Okay.
Going to people's homes after they were, home from the hospital for prolonged hospitalization, surgery, hip or knee replacements.
Sure.
So I did that for a little while.
Okay. That keeps it fresh too. You have windows.
You have windows. Exactly. Yes. And if a patient cancels, you can go run your errand.
Yes.
But that really helped. Once I had a child, I went down to 3 days a week.
Okay.
So, not that I could afford it. I was married then, and we really couldn't afford it. But I felt like I have a child. I really don't want to go to work 5 days a week, but I still wanted to. I still wanted to work, so 3 days worked for me for many years.
Yeah.
I didn't go back full time until my youngest was, and I've had 3 children. So I really worked for 3 days, 3 days a week for many, many years.
Yeah. So would you say, and this is very dependent on where one works, but in general, like the work-life balance is nice.
It's nice.
Wow.
Yes. And I know I have a friend who's a lawyer, and she could never go part-time because she said you can't do that in that field. So
Right.
PT allows that. And but then I also saw patients, friends and family in my home. I did have another job that was within a massage therapy clinic.
Okay.
So that was nice. We really referred people back and forth.
Yeah. Well, like you said, it's like the body is one unit, and you can only do so much for that person as far as your skill set. So why not bring different practitioners into the mix to create a very holistic practice?
Absolutely.
So if you could come up with the dream practice, like the dream team, what practitioners would you pull together?
Oh, that's such a good question. Well, I will tell you, not just as a practitioner, but speaking from my experience being injured. I was just injured last June.
Ooh.
And it was a significant injury.
With what?
Something fell on me, large and heavy and fast.
Oh, geez.
And as I was being treated, well, I treated myself. I was treated by my coworkers.
Okay.
But I knew I needed more. So I really feel more than ever now that I know, or like you said, the dream team. I know what's a great combination.
Okay.
So I did acupuncture.
Okay. Were you hesitant, or did you just...
Oh, no, I couldn't wait. It's like, wait a minute. I've always, heard about it and this and that, and it makes sense.
Yeah, right.
So, but to feel it on yourself was wonderful. So I understood. I felt like I'm very intuitive. That's how I practice. So, and on myself. Yeah. So I felt like I needed acupuncture, and it was terrific. And then I knew that I also needed craniosacral.
Oh, okay.
Work.
Okay.
I've taken just one class, but I've incorporated what I learned.
Like manual therapy though, like with just on the craniosacral area, or is it with acupuncture? Like what was it?
Yeah. Well, so surrounding our brain and spinal cord is cerebral spinal fluid.
Yes.
Right. So it's affecting the flow of that.
Okay.
And you can do it via the head, but also the sacrum at the base of your spine.
Okay.
And I went to a dentist, actually. My friend's father is a dentist, but he treats everybody with craniosacral therapy. He's a master.
What?
Yeah.
That's so cool.
It is. It is. I mean, there's so many different levels in our body.
Right, right.
And systems. So I knew I needed help with that. And then he referred me to somebody else who I did not know about this. It's called Orthobionomy.
Never heard of it.
I know. And I think I'm going to take the course in June. She's giving it, but it's a very light, craniosacral is a light touch too.
Okay.
But just to go back, like when I say I treated myself, I mean, I treated myself. I've learned myofascial techniques. You know, I really work on, and with everybody, you have to work on your joints, your muscles, your fascia, and your nerves. I mean, our nervous system, which is everything. And so I was doing all that, but then the craniosacral and the orthobionomy, just, it's gentle. And the idea is that the body always wants to heal itself.
Yeah.
Which,
homeostasis, right?
Exactly. Right. I mean, from the beginning.
It's very resilient, yeah.
Very resilient. Compensates extremely well,
Sometimes
though.
overcompensates.
Exactly. So orthobionomy is the practice, and really I'm not an expert. I haven't even taken the class, but it's been done to me. It's allowing the body to go back to its to its happy place in a way. Because of an injury or whatnot, you develop different, patterns of movement, or you've been traumatized, and which is true for everybody. Once you have an injury, you protect it. You like you said, you can overcompensate.
Right.
So it's a very gentle approach that just allows the body to kind of release the trauma because it was a trauma. And then just to go back to its happy place.
Yeah.
There's more to say,
Sure.
but I don't feel like I'm qualified really, but orthobionomy. So if I had a dream team,
Right.
And massage therapy too. It depends on the massage therapist. Depends on every.
Right. Have you heard of Dr. Perry Nicholson?
No.
No, he runs several classes, but one that sticks out is his Lymphatic Mojo class, and the lymphatic system is one that is very still like unknown and unheard of. But yeah, when lymph gets like stuck and it's not draining, your excess like fluids and toxins and things like that,
Right.
signs and symptoms may come about.
Yeah, I actually always say everything works for some of the people, some of the time. And it's
There's no one cure-all for everyone.
correct.
Right.
And it's whatever you want to call it. It is energy. We're electromagnetic. We're fluid.
Yeah.
Right. Blood, lymph.
He also turned me on to something called Amino neurofrequency.
Oh, my.
These like little discs that affect the like frequency and electro waves like within the body. So some of it is like very woo-woo to me, but like
Right.
But I mean, there are documented like patients that have felt better and gotten
Absolutely.
better. So.
I never say, no, that can't work.
Okay.
Never.
Really?
Yeah. The body is fascinating. We don't know
You don't know everything.
Correct. And so and plus just touch is healing. When I was in PT school, we had to do a research project. So I've always been interested in touch. I'm a touchy-feely person.
Right.
But we did our setup was taking a person's history, basically the beginning of an evaluation, you ask their history, but in the two groups, we just talked and wrote the patient answered, and in the second group, we touched them.
Oh.
And it was always the same. Well, of course, afterwards, when we had the person fill out a questionnaire, what did you think about therapy? Did it help you? Blah, blah, blah. It was better in the group where we touched them.
Right.
So, there's so much that we don't know about the healing touch.
Yeah.
There's so much about the body's just, like you said, trying the homeostasis. That's That's basically my
Do
business right now. It's teaching people how to heal themselves because our body always wants to. We just get in the way.
Okay.
Yeah.
Okay. Yeah. So tell me more about Erasore. What inspired you to come out with this?
Yeah. Well, it goes back always to teaching people how to take care of themselves.
Okay.
So from the beginning, as a therapist, I would, you're teaching somebody exercises that they should do. You're teaching somebody how to be aware of something. But, education has always been so strong with me. And as a patient myself, not just this recent injury, but my entire life. I mean, right? We all have injuries all the time.
Right.
So it's not really my PT degree only, for sure. It's the years I've spent treating my own problems that have happened, my own injuries. And I find that I always want to simplify things.
Yeah.
So they make sense.
Well,
I
I think that's how you know if you've kind of mastered the material, is if you're able to break it down and explain it to someone that isn't in the field.
Oh my gosh, so true. So true.
Yeah.
I remember at UIC when I had to take physics, because really PT is all physics too.
Okay.
It's forces, it's right?
Yeah.
Angles, it's lots of things. But my first physics class, I actually flunked. It's the only time I truly flunked a class because the professor just couldn't bring it down. I had to make sense to me. So my second teacher, I took it all over, got an A's, because he simplified it.
Right.
So that's what I'm always trying to do with people is find analogies, make it so that they can understand it. And little by little, you ask, how did it all start? Well, the name Erasore.
Yes. Creative name. I like that.
Thank you. Thank you. That was about 10 years ago, or maybe 15 or so. I was treating somebody's tennis elbow.
Okay.
And acupuncture or acupressure, finding a spot and really releasing it. Well, I like to simplify things. I took a pencil and used the eraser.
Oh, and very direct and
Very
pinpoint,
direct
yeah.
acupressure.
Wow.
And I got great results. So back then, I had somebody print Erase the Pain on pencils. So that started, me thinking. And then over the years, about 6.5 years ago, I was hired to manage a practice. And it was a satellite office because it's based in St. Louis. And I grew this practice. So I kind of,
Wait, from here?
Yeah.
How did that work out?
Yeah.
If you're not even there.
Because it was a satellite office. They wanted to open something up in Chicago.
Oh, okay. I thought. Okay, never mind. That makes sense.
Yeah. No, that's okay. I was in a different job that worked for quite a while. I was a PRN therapist working in nursing homes and rehab centers because I needed the right hours. My youngest son needed to go to a special school and there was no bus, and I needed to control my hours even more. So PRN as needed. I took this position and it was working with elderly people.
Okay.
And I had never done that before, that specific. And I fell in love.
Oh.
And to me, it was like free association all day. It was, people at that age, they are who they are, and right?
Yeah,
and they're funny. And I just loved it. So I did that for about 5 years, and then they went up and changed the whole system. They hired a company. So I signed up with the company initially because
you wanted to keep doing it. Right?
I wanted to keep doing it. They said, nothing's going to change. Well, day one, it changed dramatically.
Okay.
So I heard about this job, this clinic that was opening up.
Okay.
So, and I said, I've never managed.
Exactly. I was going to ask.
Right.
What's that like?
It was, they asked me, can you teach? Like, yeah, that's second nature, no problem. Can you give lectures? Yeah, I love doing that. okay, you're hired. So I grew this practice, and it's a nice practice, but it's great. I love it. But so a few things. Walking through Central Park a few years ago, I just thought, okay, maybe it was last year. I don't know when it was. Maybe a year or two ago. 54 years old, which is the age that my father died.
Okay.
And that certainly, is
opens your eyes.
Well, it opens your eyes when they die.
Yeah.
To the fact that life, there are no guarantees and whatnot. But being the age he was, it was another eye opener. And I thought to myself, what do I want to do with the rest of my life? Is this enough? And then I also felt like, what could I do, God forbid, if I were in a wheelchair? Because my job is very physical. It keeps me strong, keeps me quite healthy. But on the other hand, eventually I'll be too old or limited.
Yeah.
And so that's how I was thinking, what could I do if I were in a wheelchair? And so my teaching just, is at the forefront of my mind. And so I just started developing the approach or synthesizing everything that I try to teach people about how to take care of their bodies. And I created what at this point I call the Erasore Academy.
Okay.
Literally.
Okay.
1, 2, 3, 4, A, B, C, D.
Okay.
It encompasses so much of what I teach. Does it encompass all? Not completely, but I love being efficient, and I love killing as many birds with one stone kind of thing.
Don't want to waste anyone's time.
Right, yeah. and easily understood. So I don't want to call it, that whole PT for dummies. I don't like that, but anybody can understand how I've synthesized what I feel everybody needs to know about their bodies, because we're living longer. We need our bodies for the long haul.
I believe 100% in preventative medicine instead of reactive medicine.
Right. And our insurance, is up for grabs. Who knows what's going to happen? So we really need to know more. I have a friend, actually he's a business mentor too, and he said, there are 3 things that people are engaged with or involved with or dependent on that we know very little about. What are those 3 things? The body? What else do you think? Our cars and our homes. How many of us pray to God that the water, we don't need to turn off the water in an emergency? Or what would we do if we, even changing a tire, So the body, it's our only body. Yeah. It's ours. We know it best. We should know it best.
We should. And we're at a time where we don't trust the institution and ultimately the doctors. So like with the whole anti-vaxxers movement, it's like they don't trust anyone anymore. So that being said, do something about it. Don't just complain. Empower yourself to learn about the body.
Right.
I love that.
Right. And we don't listen to our bodies enough, because our bodies talk. They let us know. But we ignore it and we push through it and whatnot. But the body works best when we're really listening to it.
Okay.
So, and then the connection between the mind and the body. So when I was in undergrad, I did get my degree in liberal arts, but with an emphasis on psychology. Okay. Because I've always been drawn to that. So I love that mind-body connection. And it's accepted that we can make ourselves sick, right? Yeah. From stress, right? We can make ourselves sick. So the opposite it has to be true, because that's life, yin and yang and up. Yeah. Right? Yeah. We can make it better. And so that's why I use a lot of visualization too, which we know works too. Yeah. Great baseball players visualize that ball going over the fence. Yeah. I don't know what they call that training, but
Well, things like when you're goal setting or like planning a career, it's like you really have to like be as detailed down to like, don't just say I want to make $1 million. What does that $1 million look like? What kind of house and what kind of
Right.
walls do they look like? What kind of car are you
Right.
driving? What kind, like what kind of family? Like you have to be as focused and detailed and know what you want, which is tough for a lot of people. It's they have a brief a broad understanding of what they want, but yeah, you really got to dial it in.
Well, and I think when you start to listen to your body, it also trains you to listen to your mind too.
Okay.
And
Okay.
so, you know, everybody's looking elsewhere for answers, and it's really
Within
it's kind of
yourself.
like, yeah, the Wizard of Oz kind of thing. It's
Okay.
always in your own backyard. It's always right there.
Right.
And so it's about tuning in and even saying, you know, visualizing how you want your body to function
Right.
and to look. If you think about trees where they're growing up, but the wind is always, pushing them this way, or they're going to end up bent over. Well, now having worked with the older generation, I see the process, the aging process so clearly, besides being 56 myself.
Stop it.
Well, but it's true. And I'm still part of the baby boomer generation. And right, we are the ones living so much longer.
Yeah.
And we have been exercising. And, you get a lot of people who think exercising is the answer. But it's amazing how many people out there I see are running and they're bent over while running, or they're not really, their stride is not, and they're going to have problems. So it's like you see what's going to happen, and I've seen all those old bodies and what they look like. So I feel like I'm in just the right position, having seen that and living it. So I want to basically teach the world
I love that.
how to maintain their bodies through the aging process.
Through what platform are you accomplishing this? Is it through a physical book, an ebook, seminars, YouTube? How are you getting that word out there? And then how are you being compensated? Is it a service, a product? What is it?
Right. So I have a lot of ideas. When I was starting to think about my business plan, you look at here and now, 5 years, 10 years. So I could say right now, the idea is to reach as many people as possible in the easiest way, I guess. So yes, there's multimedia, there's little videos, but one thing I've really focused on is not just individuals, but I want to work with and am working with couples, because how many of us are in relationships and we're doing all sorts of things, but not utilizing our healing touch on one another. So I want to teach couples how to not just treat their injuries, for instance, but everyone's so stressed, everyone's so overworked, everyone's anxious and whatnot. How beautiful could it be that at the end of the day, you've been taught some techniques to do on one another. So I want to work with couples, but also groups. And excuse me,
You're fine.
Groups. So I've thought about groups of people. It could be individuals, it could be groups of couples, but it could also be groups of people who have similar issues, like either through similar occupations. I presented to the Electrology Association. They do electrolysis, and they're standing over their patients for long periods of time. So they reached out to me they had a seminar and to present sort of how to care for themselves, how to minimize their injuries. And so it could be groups of people who are in specific occupations, but also new moms caring for babies, all of a sudden carrying the baby, the car seat.
Yeah, the one-sided, yeah.
Right, exactly. Right. All those issues. It could be groups of people according to age, the baby boomers. It could be any group in a way.
Yeah.
Any group. And that's what I say on my website. Find a group and I can present, on how to approach your specific issues.
I wonder, that is so, I love, it's so lofty, but I wonder if it's too lofty that you won't hit, the target's too big, right? And you won't hit it. That's, I guess, because I've thought about that too. It's who am I trying to appeal to? I have all these different professions that I'm interviewing, but I'm not, am I not appealing to a specific target audience?
Right. So I'm in a networking group, and that's what we talk about too, right? So if I had to, that's been addressed before.
Cool.
In a way, because people will always say, I just happened to land in that. That's just how it went. And in a way, I feel like I can do and teach anyone.
Okay.
But I'm allowing things to happen organically too, wherever.
Yeah. So with people that I've interviewed, for entrepreneurs, they have always fallen back on the success. They've stated that the success of their business is due to word of mouth, and that kind of surprised me initially. But I hear it more and more these days. Even with the prevalence of social media, word of mouth is still the strongest factor in. Because, when people hear about you, they're hearing about you through a trusted, maybe a previous client. And because they trust them, they'll kind of automatically, through them, trust you as well.
Right.
And over time, I'm sure, since you've started working as a PT, you've built a certain clientele. And, people know who you are. Mm-hmm. And that just helps when you eventually do want to branch it on your own. They're like, oh, I've gone to Shelley before. I totally trust her. And so I think what really helps is maybe when you get the site up and running, testimonials. Mm-hmm. Reach out to previous clients and hey, can you say a little blurb for me, and that'd be great. It goes a long way.
It's true. I do have a couple. You're right. You're absolutely right. And maybe because I like variety and it keeps me fresh. I don't want to just. I have another sort of mentor who said just stick with the baby boomers, but I have to be true to myself because also I feel like the Generation X, the 30-year-olds, they don't know that one day they're going to wake up and have this pain. So I want to teach them. I want to open up their minds a little bit because they think at this point they're good. They've got their exercise routine. It's interesting. We'll see. I could stick just with corporate. So that's another thing. Corporate. People who are sitting at their desks all day. There's so much you can do.
Oh, the world is your oyster.
Yeah. Right. And it's funny. I always say to my patients, you could do all the exercise in the world, but then you walk out and you're like this.
Yes. They have to do the homework. They have to change a lifestyle,
Right.
Yeah.
Right. And so kind of if I had to say in a nutshell, follow my 1, 2, 3, 4 ABCD because it really, I could say what it is. It's not like it's mine. I've trademarked my name.
Sure, yeah.
But if people just are aware of it, we talk about being mindful. Okay, being mindful in your mind. Well, being mindful in your body, and that's the A. Assess your angles. How are you sitting? How are you standing? How are you lying? How are you bending, lifting, everything all day long? If you can just do that, then that and walking can really cover a lot.
Right.
Yeah, it's this sitting, it's this compression. I've seen the
face in the phone.
and my older people, they have shrunk 6 inches sometimes.
Wow.
Right.
From the compression or from slouching and all that?
All of that. Gravity. It's not always our friend. So it's lifting up. I love like I said, making it simple for people, the analogies. Well, sometimes I'll talk about the body as like a car.
Yeah.
Okay. There's so much, the carburetors, the lungs and the springs, the
Right.
shock absorbers are our discs and whatnot. Right. But also think like a tree. I love looking at nature too. Your roots are going down into the ground, but the tree is growing up. So think like a tree and grow up, kind of thing. And it's about that, because we're just, I like to compare what's going on in our minds too. We're compressed, we're stressed, we're bogged down, like all those words. It's lifting yourself up.
Yeah.
It's there's so many comparisons out in nature, and so
Yeah, like one, for example, maybe before the leaves and flowers like blossomed, branches maybe look like our lungs, and like what's cool.
yes.
I've recently like thought about this is noticing what's there, but also noticing the spaces between.
Yeah. Yeah. No, absolutely.
Yeah, that kind of got to me.
Right.
So I don't think we ever answered this, but like going back to your dream practice, who would you involve? Like chiropractors, acupuncturists, dietitians? There's even research being done on psychedelics and the power of healing that maybe it can do, like psilocybin or even LSD for PTSD and depression and things like that.
Yes. And crystal meth, I think. I know. I just read a book.
I haven't seen that one yet, but
well, yes.
Anything can be overdone, right?
Anything can be overdone. And I don't want to be the practitioner that says you have to do this and you have to do that. I touch upon everything. I touch upon diet. You have to. Water intake, what foods you're eating. I mean, I address all that.
It has to fit their lifestyle. Like they'll probably make minor tweaks to their lifestyle, but we are creatures of habit.
Yes.
Right? So we have to find a diet or a movement that fits within our lifestyle.
Right. And I especially learned that with the elderly.
Okay.
Who,
because they're stubborn. They're not going to change.
Exactly. And so I meet you where you are. I mean, you have to. Right. You have to. I don't want to tell you what exercises, or what you should do. First of all, to exercise, you have to find something you love.
Yes.
And I love to dance. Dance to me incorporates everything that I teach because it's moving your body through every angle imaginable. Because if you think about it, our bodies have to last for the long run. The tortoise and the hare, who won the race?
Yeah, exactly.
Slow and steady wins the race, right? But the other thing is, and this is the C of the ABCD, change your go-to pattern, right? If you're always going to your neighbor's house, walking on the grass the same way, what's going to happen to that grass?
It's going to die.
Right. You got to change your pattern of movement.
Right.
So, and so it's change. But that's also good for the head, right? We talked about the people who do best in life are the ones who can adapt to changing situations. So here we're given this body that can move all these ways, but so many of us just stay in our same
lane,
So we wear out there. Right. And it's such a simple concept. It's like, okay, start moving a different way. And pain is a great reminder.
Right.
But if you could just get that, everybody wants their apps and to remind them and whatnot. It takes away. I created something so that people could easily remember it, and you don't have to keep going back to an app. It's in you. It's just in you, and you might need cues or to remind you. I put a little note on your computer screen, on your bathroom mirror, wherever. But once you do get into a habit, and we all create new habits, it's possible.
Right.
I know they've done studies. It takes so many hours. I have just very simple ideas. You stretch in the morning for one reason, you stretch at the end of the day for another reason. Like morning stretches are more about you've been lying still pretty much for 6 to 8, 9 hours, whatever. You need to sort of open up. And at the end of the day, you have to stretch because here you've had all these insults coming at you all day, whether it's emotional stress or physical stress. And at the end of the day, just releasing everything so that when you go to sleep, sleep is the time our body restores itself. It restores itself even more.
I love that.
Yeah. And then during the day, it's just the ABC, assess your angle. Balance the two sides.
Yeah. I like that.
Change your go-to pattern.
Two very simple things.
Simple things. Yeah. And decompress. And there are ways to, but it addresses our joints, our muscles, our fascia, and our nerves, because all of that gets compressed. Imagine it's like being in a tightrope a straitjacket. Okay. The way we tend to end up.
Yeah, even at the end of the day.
At the end of the day. Right. Certainly at the end of your life if you haven't maintained that mobility. So what's being compressed? Everything. Yeah. Your lungs, your breathing, your nerves. Yeah. Which our nervous system is overloaded. So it's keeping all that free, everything flowing better, and it's possible. You don't have to do that much. It's just the idea that, okay, we really need to move like an asterisk. That's pretty much.
Ooh, I've never heard that before. That's cool.
Yeah.
I should trademark that.
Yeah.
That's awesome. I forgot what I was just about to say, but I really wanted to touch on. Oh, so you've worn many different hats as a PT. Were there any parts where you felt frustrated or limited in any like different roles as a PT, whether that's in the hospital, nursing home, PRN, or out like in when you make house calls, like maybe like with insurance or anything else? Like, were there any frustrations or limitations to it?
Definitely insurance, but real quick.
Sure.
The job I left.
Yeah.
As soon as they changed everything, because it was corporate. They demanded 90% productivity, which...
How do you measure that?
How much you bill.
Oh,
yeah.
No.
Oh, yeah. So, So I lasted 2 weeks, and then I found this managerial job.
Yeah.
So that was, if I'm not happy, I can't live well.
And some people get trapped because they throw bonuses at you and more vacay or whatever it is.
Many people are trapped.
Or they have, and you did too at the time, but like maybe they have people that depend on them for this steady income. Right.
And so if you truly, truly can't change and move, you have to find a way to find your peace. Right. And so there are ways to do it and whatnot, but if you're not, our jobs are a big part of our lives. So if you're not happy with your job, it's hard to be happy. Yeah. But if you truly, truly can't move, there are things you can do, I think. But as a PT, it's pretty open. There are a lot of places that will continue to need a lot of people. 10,000 people a day are turning 65. So the need continues.
The need is there. Okay.
The need is there. Okay. But it has become more corporate. Okay. And so maybe that's another reason why I'm happy in my present job. Yeah. It's not crazy productivity, expectations. Really isn't. I just feel like at this time in my life, I want it to be mine now. Yeah. I've built a little practice, so I want it to be mine. But in terms of, yes, like insurance.
If you're first starting out, it might not be as easy to start your own practice. What are your thoughts on like outpatient centers, like ATI or Athletico and things like that?
I know they're very good therapists. Okay. They're very good. But with the corporate,
Yeah, it's
it's
for profit, right? So
yes, and I'm for profit too.
yeah, but it's how you go about it, though. You know.
Yes, and what's happening is the therapists have less time to work with the patients one-on-one.
Okay.
There's more paperwork to justify the need for therapy. And in these places, one way they save money is hiring PT assistants, aides, which can work for some people, but I can't do that anymore. It's one-on-one. I think it's more
And
efficient.
You dictate how much time you have with the patient. Like if you need more time, you have that availability.
Right.
That's nice.
Right. Insurance is, demanded, and Medicare. So at first I thought, I'm not going to deal with insurance at all. I'll just take cash. Because, here people are so willing to pay $80 for a massage or $80 or more, or whatever, for acupuncture, but they have a hard time going to PT. Well, I think part of it is because there's been this typical model, 3 times a week and this and that, where my feeling is at this point in my life, so I can feel like I'm really making the most difference. It's whatever, not just I think they need, but what the patient thinks they want and need. So I could see somebody once if they feel like they've got a handle on their body and just need some, tweaking, or I'll see them once. That's fine. If you're not trying to submit to insurance, it is easier if you just do cash, because there's no expectation for frequency, duration. I can spend an hour and a half with someone and teach so much that might be enough for a while. But I have become a provider for Blue Cross, so I am covered, and I do have someone who will do my billing for me right now.
Okay.
Because there's still people who want to go through insurance, but the truth is, so many people have such high deductibles, they're paying for it anyway.
Still paying for it, yeah.
Right. And if people just, I think if once we take it upon ourselves to treat ourselves, you feel like you're more in control.
You're not dependent, yeah.
Right. And that's the goal. I don't want to make PTs obsolete, or, we all need...
There's always going to be a demand for physical therapy.
Absolutely. But we need to know, the faster you deal with an injury, the better the outcome.
Yeah.
And so if you already know, what to do right away, because a lot of these places, even ATI, Athletico, they may be very good, but frequently there are waiting lists too. You can't even get in right away. And research shows the faster you start treating an area. And so...
Yeah. We kind of mentioned this off camera, but there are limitations that insurance sets for a patient to go seek physical therapy. Why is that? Why do they cap it? Because like we said, maybe an injury doesn't get healed within a certain amount of time. You need further treatment.
Right.
So what does this patient do? They got to fork out all this cash after their insurance caps it off? What?
I can't answer for the insurance companies, but I mean, you can imagine.
That's frustrating.
It's very frustrating.
For the provider and for the
Absolutely.
patient.
Absolutely. Sometimes I remember thinking oh, well, we have to keep seeing them because otherwise they may reject it. And because they're saying, well, if they don't need it, why are you still seeing them? But the healing process takes so long. Depending on your age, if you have other physical symptoms, soft tissue takes longer. Bone heals within 6 weeks, but soft tissue injuries take months. So it makes more sense to spread treatments out, and we're dictated sometimes. I hope it's happening less. I would love to work with. I would love to see insurance. We've talked about but insurance rewarding people who really take care of their bodies.
Yeah.
If you can. And I know there's
some companies do, not insurance, but some like Northwestern Hospital.
Yeah.
At least gives you a stipend to like join a health club or something like that.
Yes. So right. So we need more of that.
Okay.
And I almost feel like my program kind of, because it's, to me, it's like a manual
That would
for taking
qualify,
that it would qualify. Like if you take this, then, you know, maybe your insurance premium or whatever, just there has to be some changes. I know, but all I can do is not one person at a time. I want to do couples, groups, as many people at a time.
That's amazing. That's awesome. Is there anything you would have wished you knew going into this world, or like you feel like, and I think I know what your answer is going to be, but is there anything you would have done differently? Because I feel like you've kind of tasted every like little parts of the world of physical therapy, and you are where you are now, and like you were in different areas, like you were at the nursing home or like house calls because you were at a certain point in your life where that catered to your lifestyle, right?
Right.
So,
right.
I think everything worked out the way it is.
Yeah.
The way it did.
Yeah. And I feel like, you know, we all have our bucket lists or ideas. Like this is one thing, as strong as it was, you know, that's what I wanted to do. PT. Yeah. I couldn't imagine doing anything else. At this time in my life, I feel like I have to try this. I have to do this on my own, see where it goes.
Okay.
And that's the only thing in my view that I have left to do.
Yeah.
I want to take
cool.
this
Nothing
as
more?
far. Well,
this is
you
it,
know,
huh?
Yeah. Well, you know, truthfully, could there be Erasore clinics all over the world? Yeah.
Man, have you heard of MyoDetox? They're not in Chicago yet. They're Canada-based, but they opened up areas in LA and Hollywood and things like that.
Yeah.
But they've it's like physical therapists, or they call them physiotherapists up there. I think massage therapists, and then I think chiros as well. But man, like you guys, you can incorporate dietitians and maybe even nurse practitioners, whoever you feel is necessary for a holistic treatment for a patient. And I haven't seen anything like that, something as complete and whole like that, and I'm wondering why.
Well, I think we just keep getting better and better about, you know, everything's a process.
Yeah.
But I am working with and about to sort of become part of a wellness clinic.
Yeah.
And with a psychotherapist. So it's the body
just you
and
two?
the mind. No, there'll be more, but there's so hopefully it'll be more of what you're thinking of.
Yeah, like a one-stop shop. And you guys just kind of refer each other in the circle. It's like, well, this is as much as I can do, but like, you know who could really help? This person, like right down the door.
Well, I definitely do that anyway, you know, especially with my background of knowing what worked for my body after my injury. Right. Like, that can help that. And,
Cool.
Yeah. And then there's an idea of a tool because, you know, we all have our little tools that are rollers, our massage tools. So from the pencil, this is how I first started thinking about Erasore.
Patent a product that like...
I did not yet. Okay. I need a 3D printer. I need somebody who will help me. Yeah. There you go. Who will help me develop that. But to make it easier, not just for the average person, but say a person who is a hemiplegic or person who has arthritis. So I have that in the back of my head. We'll see where this takes me. Yeah. I'm open.
Were there any patients that initially came in like your like last hope for them, and you've really like opened their eyes to the world of PT, and they didn't expect anything to come of it, but you've kind of like improved, like drastically improved their life?
Yes.
Wow.
Yes. PTs have a really high level of job satisfaction.
Oh, amazing.
But yes, not to, you know, toot my horn, but yes, I've helped so many people because of my approach, I guess.
You take your time, you're thoughtful, you analyze the body as a whole, you find out what they're doing in their life.
Yes, I kind of address everything.
Right.
I really do. I address the mind. I will go, emotional, spiritual, whatever. I see the whole mental.
Yeah.
I do. I kind of treat it all.
Yeah.
I'm a mini psychologist, I'm a PT, I'm an intuitive healer.
Do you think that can be done in other fields? Like, I think it can, but like OT or Chiro, like they can be as holistic as well.
Why not?
Yeah, I guess why not, right?
Why not? Why not?
Like you never feel like you're outside of your scope? Or it's just easier to add on to the scope, which is crazy because people just like trust you without anything hanging on the wall, like a certificate for that specific whatever you're doing.
Right. It's funny. So much of it is really common sense. It's all out there, right?
Okay.
We have to, suddenly there's this new research that comes out that says blah, blah, blah. Sorry. We have to trust that we know our bodies.
Yeah.
We do.
Yeah.
We're with them, right?
Yeah.
It's our only body.
And it's very simple. Like you're reminding people that to like get in tune with their body.
Yes. And that's what I teach.
Okay.
It really, it's in a simplistic form.
Yeah.
Yeah. In English and Spanish.
Yeah. Oh, really?
Yeah.
If you could give any advice to pre-PT students, people that are thinking about the world of physical therapy, is there any advice that you'd like to share?
Yeah, don't get caught up in the corporate kind of approach.
Okay.
And if a job doesn't feel right, if they're pushing, the dollar bill, and you're not comfortable with that, trust your gut. There's a lot of places that are still practicing the way
It should be.
it should be.
And the way I think every healthcare practitioner, before they get into it, has these thoughts that they'll have the time to spend with each individual patient and to actually do genuine healing, right? And then when you get into it, you find out that like maybe insurance is running the game, and like you have to push out a certain number of patients in a certain number of hours, and it just feels more like a job at that point rather than a fulfilling career.
Right. It is sad. I think sometimes the older therapists, we do talk about that if we were just starting out, but the young people, they're used to writing on computers. That's a difficult thing too, even trying to teach someone, look at someone, touch someone, but still be. So I'm always behind in my paperwork because I can't do that, right? I can't. I dropped out of typing class in 7th grade because I said, I'm not going to be a secretary.
Oh,
so my typing, I still have to look.
Okay,
and so, it's hard, but they're used to typing, so they can do it. I mean, so maybe it's not as much of a struggle for them. But
well, maybe you can just transcribe.
Yeah, there you go. Right, those programs.
Exactly.
Yeah.
Cool.
But listen to your gut. And, yes, we're taught in school to look at this and this and this and this, but don't forget to just trust your instinct too. And you are the professional and you've been trained. So if you don't even want to look at this, that's okay. You go. It's just trusting your instinct.
Okay. I like that.
Yeah.
Where can people find you, Shelley?
Well, erasoreinc.com.
Okay.
On my website.
Sure.
I have a Facebook page.
Great.
My email, skleinman, KLEINMAN,
Sure.
at erasoreinc.com.
All right. I'll put it all in the description in the video.
Okay. Great.
Is there anything else? Because that's all I had. I learned a lot. That was very insightful.
Thank you.
Very deep. Very. I don't know. You make me want to go back to school.
Oh. And become a PT?
Yeah, potentially. I've only said that's the second time I said. The first time was with the chiropractor. It's just like to be able to constantly be learning and improving yourself as a practitioner, but then being able to share that with your clients and patients, and how easy that is. Like, that can go both ways. You can be a bad practitioner and give bad information, and but if you, like the chiro, like, and you genuinely want to help and heal, and I think you guys are doing a great job at
And
it.
I live what I teach.
You live what
and
you
that's
teach.
that's yeah.
Yeah. And as a paramedic, I feel like I get people when they start seeing these signs and symptoms, but I'm not in a position to teach them how to have any corrective behavior or like change any lifestyle patterns or anything like that. So yeah, I don't know. I wish I did this stuff and did my research. Like, the point of this is to help help people make informed decisions on what they want to do in life.
But this is how you're doing it.
Yeah,
You're bringing this.
So,
Yeah.
late bloomer.
We should always be blooming. Right.
So yeah, I guess cut the late and just I'm a bloomer. Yeah.
There you go.
Well, Shelley, thank you so much for the insight.
Thank you, Victor.
For spending the time, and I hope the audience gets something out of it as I have. To everyone else, thanks for paying attention, staying tuned. On to the next episode. Stay curious and habla aloha. All right. Thank you.
Thank you so much.